one part of hypnosis is also hypnosis birthing, which
Right.
is giving birth without anesthesia under hypnosis.
Right.
You were actually brought into Fortis Hospital for hypnosis birthing. So I just want to understand, why would someone want it or need it, and how do they do it?
So, hypnosis birthing is actually one of the birthing programs, but more importantly, it is a program where we can use a hypno-anesthesia technique to anesthetize oneself while one can still feel the contractions. So, the reason why people would like to do it is people would like to avoid painkillers, which have become quite common at the time of birthing. And people would like to hasten the process of labor because it has been found through multiple studies that it can actually hasten the process of labor by just bringing nature back, meaning letting the woman step out of the fear response and bring the balance of the body back, and the body knows what to do, and the body would not take that long to do it. And hypnosis birthing has definitely helped people, according to major research studies, including the systematic reviews, in decreasing the need for analgesics or painkillers. It has also led to a much better subjective experience. For example, the British princess went for hypnosis birthing during her birthing process and had some wonderful things to say about her
Princess Kate.
experience. Princess Kate.
Is it because a woman, she's scared of the anesthesia, or is she scared of the childbirth, or why would someone opt for that?
So, one of the reasons for opting for that is that there is this cultural programming that women have, which is that childbirth is going to be so bad. It's the worst pain that you can go through. There's so much fear around it that unfortunately that becomes a self-fulfilling prophecy.
So then you have to take the anesthesia,
Then
the
you have to take
epidural.
the anesthesia, the epidural, and along with that sometimes, or before that sometimes, even painkillers. Whereas what you do through the hypnosis birthing program is, apart from the hypno-anesthesia, you also train yourself for not being in that fear response. So it is making that process in our mind more natural, more self-limiting and self-containing, which I believe sets the stage right for the hypno-anesthesia to work.
Got it. So it reduces fear and makes for a more positive and shorter birthing experience.
That's right.
And natural
And
birthing experience.
usually natural.
Got it.
So I remember I was called a few times in Fortis to the labor room, and I was told that this particular lady is unwilling to go for cesarean section, and there is prolonged and arrested labor, and
So it's
she's
an
completely
emergency.
yes, she's completely unwilling. Do you think you can try something with your hypno-anesthesia and hypnosis birthing? And I told them, as first and foremost a medical doctor, that we can only give it a trial till the safe period allows. Like, we cannot just go on waiting. And almost in every case, to my own surprise, it's almost like the body knew what to do. All I had to do was give the right suggestions, induce hypnosis, give affirmations to, feel more confident, more trusting, and then gradually induce the hypno-anesthesia.
But this
And
was,
almost-
they called you this at the time when the woman was there. So it was an emergency.
It was not only an emergency. I had never seen these women. They had no idea
So at that
what
point,
hypnosis birthing was. They were just told that, you want to try this? And they said anything except epidural, anything except
C-section.
C-section.
And how much does the pain reduce with hypno-anesthesia?
So depending on the level of training. So if they have trained well for over 6 weeks, at least 6 weeks, over 6 weeks would be ideal, the pain significantly reduces. For example, there was this one of my first patients, and again, she was from another country. And her gynecologist was very surprised because she said this was the first time I actually saw a no noise birth. Like, not even like nothing. It was like a no noise birth. And it was like she was on the top of things. And it was almost like I was there to assist her, but she sort of birthed herself. So,
Wow.
depending on how much practice someone has had, the anesthesia can work, to different degrees. I wouldn't say it would be absolutely pain free. That would be a lie, at least from what I have seen. But pretty pain free, pretty enjoyable. Apart from, of course, the contractions, that's a new feeling. One has to get used to the feeling. And looking at the contractions not as pains, but as just what they are, contractions.
I see. And statistically, this is safe. There's no problems with it.
Yeah. That's the best thing, that there is no downside as such.
There is no downside, right?
Yeah.
Because you're going to deliver naturally anyway.
Yes.
You may have a lot of pain, or you may not have a lot of pain. You may hate your hypnotherapist,
Yeah.
or you may not hate your hypnotherapist.
Yeah.
That's the downside.
I have had a few patients who knew that they have to go for the cesarean section, but they still went for hypnosis birthing. And when I asked them that, why do you want to do it? Because yes, there are other benefits, even in a C-section, even in a planned C-section, there are other benefits. But they said that they wanted to do it for the program and to generally feel on top of things and not feel like a passive person in their own body, not knowing what is going to be done to them, and then suddenly waking up with a scar and a baby.
Yeah.